Hello everyone, I am Dr. Naveen Kumar LV. I am a senior consultant in orthopedics and sports injuries at Manipal Hospital Sarjapur Road. Ganglion cyst of the wrist. This is a very common condition. People come to me often with. All we are talking about is a little bump which usually appears on the back of the wrist, or in some people it may be on the front of the wrist as well. So just because there is a bump on the back of the wrist, you don't have to worry about, or not all of them are serious or problematic. As long as we can confirm that it is a cyst or it is something which is filled with fluid, you don't really need to worry about. So ganglion cysts happen due to a reason, because there's a bit of increased pressure in the inside the joint or in the tendon sheaths, and the fluid will start getting accumulated or pushed to one side and it becomes a little pouch. So when we talk about the ganglion cysts, these things can form around the wrist on the front, or more commonly on the back of the wrist. Here, usually deep to the muscles in the covering sheath or layer of the wrist joint, the fluid will start getting pushed to one side and that fluid will start accumulating in a pouch. So here it becomes a trapdoor where the fluid comes into but doesn't go back. So eventually it forms a bulge over here, which is called ganglion cyst. So this one, although it's alarming kind of condition for patients sometimes, but it's a harmless condition. So having a bump here doesn't mean that you need a surgery, because a lot of these will be pain free and one would still be able to do all the movements, do all the activities without any pain. If it is not causing you any bother, honestly you don't need any treatment. If it is causing some pain or problems, usually we ask you to do some simple basic exercises. If that helps, well and good. If not, we do a little injection to take away the inflammation around that area. But mind you, it's not something which I can suck out and make it clear, because even if I try to suck it out, the fluid will be very thick, and even if it comes out, it will fill again. So that's not a treatment for this. So if that ganglion cyst is causing pain recurrently, even injection has not helped, and you are having difficulty with your day-to-day activities, with movements or putting weight on the hand, then we may need to consider a little surgery to remove the cyst, which is something which happens within 20 minutes of procedure, and you can return back to your normal activities within 2 weeks. Hope this helps. Thank you.